Dear investors, media friends, good morning. I'm very honored and happy to have this opportunity to share with you PingAn Good Doctor's role within PingAn Group's health ecosystem, its role. And I also want to share with you in what we have done in the past several months and our strategic upgrade. There are quite a lot of contents in my presentation, but first I will start with an introduction. Actually, my report is made up of 3 parts. First, PingAn Good Doctor is China's largest internet healthcare entry portal. Second, key information is PingAn Good Doctor is a synergistic entity within PingAn Group's health ecosystem, and it has close relationship, close synergy with other parts of PingAn Group. And also, PingAn Good Doctor has been dedicated and is being a bridge between patients and doctors. PingAn Good Doctor, I believe many of analysts and media friends already know PingAn Good Doctor well, but I would like to align you with some key information and history of PingAn Good Doctor. I will briefly introduce the history of PingAn Good Doctor. First, PingAn Good Doctor was founded in August of 2014, and now it has experienced 6 years of fast development. Now it has become China's largest internet healthcare service provider and also entry portal. We stick to our initial purpose of providing 7-day, 24-hour high-quality medical services for users and patients. PingAn Good Doctor was listed in Hong Kong Stock Exchange in May of 2018, and in August of 2019, we launched private doctor products. And in September of last year, our registered user number exceeded 300 million. And in April of 2020, our market capitalization exceeded 100 billion Hong Kong dollar. And in mid of 2020, we initiated a strategic upgrade. Just would like to draw your attention to the market potential. In the internet vertical areas, healthcare rank number 2 in terms of market MAU. However, we expect it to rise to number 1 in internet vertical areas. PingAn Good Doctor, as a largest internet healthcare entry portal, has an MAU of 67 million, which is higher than the combined MAU of top 2 to top 10 peers. So the information or the key message is that in next 5 years, PingAn Good Doctor sees huge growth space and will continue to be the largest internet healthcare entry portal. There is huge space for growth. Jessica Tan has made an extensive introduction of the medical and healthcare ecosystem. In this slide, we can see customers, users, and there are also other components, payer side. However, if we look at it from PingAn Group's perspective, we have deployments in every aspect of the healthcare ecosystem. PingAn Good Doctor occupies the patient side, and we get traffic from PingAn Group and also from other offline channels. This huge traffic, we can distribute the traffic to other medical providers. Some of the provider is done by ourselves. For example, the online part is provided by PingAn Good Doctor. We provide online to offline medical services. The offline services is also done by other PingAn health ecosystem entities. For example, PingAn Smart Healthcare and PingAn Hospital Management Team. There has been synergy between the different components. And on the right-hand side, which is payer side, it can be provided by other entities, insurance, commercial health insurance, business, or under PingAn Group, for example, PingAn Life, PingAn Annuity, Health Insurance, and Health Connect, etc. This will provide convenient services for our users and patients. So we can see on the centerpiece horizontal part, PingAn Good Doctor occupies the patient side, start with patient side, to explore value and also to provide online medical and healthcare services. This is the role of PingAn Good Doctor within PingAn's healthy care ecosystem. PingAn Good Doctor are building a bridge between patients and doctor. It's our vision, and we want to provide professional communication and bridge between patients and doctor. You can see the indicative bridge in the slide. On the left-hand side is patient and right-hand side is doctor. And underpinning the patients and doctors are the resources from PingAn's healthcare ecosystem, which include doctor resources, medical services, general practice services, specialist services, etc. So where are the patients come? Where do the patients come? This is the frequent question we are often asked. Before the strategic upgrade of mid-2020, our traffic mainly comes from CN, individual customers. We already have 346 million registered users. We provide them 7-day, 24-hour access to high-quality online healthcare services. Another source of traffic is from insurance side. We cross-sell services to insurance customers. Also, we provide customized protection services and medical services to insurance clients. We form synergy with the insurance business under PingAn Group, so that the financial or insurance customer can enjoy our medical services. And after the strategic upgrade, we have two more channels. First is HN, which is hospital side. We build internet hospital either through self-build model or co-construction model. We know medical services is low-frequency action or behavior. So through hospital, we get more traffic from hospital sides, provide online services and online solution for offline customers. Well, when talking about hospital, many people think it's asset heavy. However, it's not the case for our model. We mainly refer traffic from offline to online, particularly for small complaints and mild illness. Now, PingAn Good Doctor has over 32 internet hospitals, and 14 of which has been in operation. Another new channel is BN, which is from corporate channel. We provide innovative health solution for corporate clients. China has a population of 1.4 billion. And what services we can provide for corporate clients? Many people will think of health checkup services, but it's not all about the services that we provide for corporate companies. Our vision is that every employee can install an app of PingAn Good Doctor, and when they feel sick, in the past they need to wait in long lines in hospital for a hospital visit. But now they don't need to ask for sick leave and to leave the company to seek medical services. They can seek medical services on the app. They can save a lot of time, efforts, and resources. Some companies have corporate clients, but it's not well managed. We want to transform the old-fashioned and inefficient corporate clinics into a easy-to-access, convenient clinics. So that we can provide efficient, high-quality medical services, easy to access to employees. Just an example.
So our solution for large corporation, we can provide resident staff to the infirmaries. So our resident HCP, they're going to provide consultation, health management, and diagnostic treatment to their employees. For mid-sized companies, we can have tours by doctors, regular tours. So you know these scenarios. Usually you go, this is in a normal infirmary of a company. It's not. There are two differences. First of all, the corporate infirmaries, they have a 1+1 services by doctors. First of all, they are GP, but behind the GP, they are being supported by the on-screen resources. They are being supported and connected to all the specialists, connected to all the robust medical resources. They can seek all the specialist advisors through the system, and we can actually provide multidisciplinary solution to one patient. In the past, it was difficult, but now in Beijing, Shanghai, Guangzhou, all the experts can be connected to one screen and providing services to one patient. This is not very difficult to do, but this is something that has been done by us. At the same time, we talk about screen, but if you look at the screen, you know we have the 1-minute clinic. For small, medium companies, we provide a 1-minute clinic. That is to say, for SMEs, for example, in an industrial park, we're going to have a mobile clinic where the patient will come in and the patients can be consulted with these doctors and specialists. So what the corporate gets from these services? I think this is not just about providing more care to the employees to build the image as the best employer, It's not simply a way to help the companies to make a saving out of the sick leaves by the employees. I think it's more important for the companies to gain their own health dossier. The health dossier is really coming from the health management services that we render, the body check that we provide, and all the diagnostic and treatment data that has been collected in the course of providing services, with all the data that has been collected, which come into their employees' health files. So that was the 2H. In the country, we have launched 14 internet hospitals that have gone live. Through the internet hospitals, our patients can find it easy to access our SaaS system on the cloud. The cloud linked to the offline hospitals. The treatment diagnostic, because we take care of the pre-diagnostic, and the treatment is handled by the hospital, supported by the smart system like the registration, pharmacies, and payment. After they leave the hospital, all the follow-ups and callback is being taken care by our system again. So from the online, offline, and online, we connect the whole process. Now, we talk about the left side of the bridge. Sorry, on the right. We just talk about the left. Where do we get our patients from? I'm going to take you to the next end of the bridge, doctors. We hope by providing a virtual office for the physicians so that our doctor will have the perfect solution for them to practice. Now, this can be understood as a professional platform, but this is more than that. They can scan the QR code so that they can guide the patients onto the platform, and also they can search for the history of the patients, how many times, how many visits, the previous visits of the patient, the previous prescription of the patients, and they can also check for other doctors in the same discipline or the senior doctors. They can reach out to these resources to seek advice. And also on this platform, they can also post their own opinions. They can also participate in a forum on this platform. So by way of developing a virtual office for the doctor can perform their academic research, they can achieve income, they can build their own brand, they can build their capacity, they can also improve efficiency. On the right side of the bridge, in the PingAn Good Doctor, we focus more on focusing on the AI doctors. By way of AI doctor, we train the AI, as mentioned. It's not just about getting the information. It's about solving problems as well by a lot of AI application, by smart critical illness monitor and a smart medication monitoring. They can actually help the physicians to save a lot of time. The time saving is around 35% by our estimates. Thirdly, the resident or in-house doctors. As you say, we have our resident in-house doctors. We have 1,800. These are our in-house team of HCPs. The latest number is actually much higher than 1,800 now. So why we want to own these in-house doctors? Now, if you go to our app and experience the app, you will feel that it's highly responsive. Without our own in-house doctors, probably you have an inquiry in the morning, you're going to have a reply in the afternoon on the next day, but on PingAn Good Doctor, we have to have someone to take your question in 30 seconds. On average, your query is responded within 17 seconds. So we provide optimal experience and for improved convenience. So that was story before the upgrade. After the upgrade, we built on top 2 more layers. So the physician system is become more fully developed. So we are already developing around 10,000 specialists on contract with us. These contractual specialists, they have different disciplines and sub-disciplines. They can help our patients to answer some of the more specialized questions, not just the mild common cases, but more complex cases. So we say, if you want to be healthy, you should go to PingAn Good Doctor, and you go to PingAn Good Doctor, you are being consulted by renowned specialists. And also on top of that, we have a lot of top experts in the country when we build a virtual office for them. So if you go to our app, you're going to see we have some of the renowned doctor offices, and you can expect more to come. This renowned doctors virtual office, they can deal with some of the acute cases or severe cases. They build the brand for us at the same time. It's not just about building brands for patients. More importantly, they are building the brand among the physicians population. So for every discipline, for every specialization, we are being developed as a trusted channel. Now, we just talked about healthcare. Let's now talk about health. Now, health is a newly developed segment. I think healthcare and health goes hand in hand. We hope to build a full lifecycle health management system so that our user can receive the holistic solution from treatment to health management. So what do we do about health? So in the middle, you can see private doctor. Private doctor is the hub. By private doctor extending forward, we can provide health, exercises, nutrition, and lifestyle support. So this population, they're going to receive the health consultations. These are the common general populations. We provide all the health, exercise, diet, nutrition support so that they can be more mindful and aware of their health. And to the back, for the sub-health population, we provide some of the, workplace care and consumption health care and targeted sub-health care population management. So there are some categorizing, there are also individualization. So we want to make sure we know what is the last visit about, what population is patient from. Is it for the spinal or cervical? Because spinal and cervical problem are very often seen in workplace employees. So we have tailor-made solutions for them. And the solutions is not developed by humans. Very often, most of the solutions are actually developed by AIs with some input trigger. Some of the keywords they're going to trigger to a human expert for intervention. Who are the experts? These are we have the private coach, private influencer, and nutritionist, and also psychological therapist. So the three experts come together to provide our users with more holistic services and also connect to the offline with an O2O connection. With all that, you can see we're actually are seeing a story, just like our corporate healthcare. We're providing this to corporate, but also we can provide the same to individuals because the data in the process are collected by ourselves, and all the health checkups and the treatment diagnostic data are being captured, so we can provide them with a more complete health record. And this health record is a personal account. Now, when it comes to medical service, we hope to provide a specialty-driven professional medical services. There was a slide talking about in the past, we provide more GP kind of services. But next step, good doctor want to develop more specialists because it's going to cover more specialty discipline. Right now, we cover more than 23 key disciplines now. And these disciplines, some are naturally eligible for online, and some need to be connected to offline practices. So you can see by the general practitioners consultation, they are being referred to different specialties. The top 5, like the gynecology, pediatrics, TCM, etc. So these are some of the very important disciplines. So for the specialists, they can use a variety of tools to connect to the patients. In the past, there are photo or text, but now we have video, audio, and telephone consultation. So many ways for the doctor to reach out to the patients to communicate and provide solution. And going forward, then we're going to do two things. Firstly, we're going to distribute to our own. For example, private doctor, they're going to refer to our private doctor teams. So our private doctor will take it from there. They're going to take care of the patient regarding their disease progress, provide progress management so that they can provide patients with a timely reminders, interventions. And if it's a one-off without private doctor service, then they can be referred to the follow-up team. The follow-up team is going to follow up the patients by WeChat, corporate WeChats, or by phones to call back, follow up on the patient to see how the patient is doing after medication and what is the health status. In the same time, these patients can also be referred to the offline settings. They can be referred to our physical examination organizations. Like after the online consultation, they can go to the offline for body check, and they come back to the online to interpret their findings so that they can be referred to the best suited institution for further interventions. So with this opportunity, I'd like to really take you through and introduce to you our latest brand, PingAn actually, this is really the logo with a heart with a cross in the center. This is going to a brand that we're going to really launch strongly. There are three connotations. First of all, it means the home to the doctor. Every doctor should have a more open, holistic, and convenient virtual office. On this virtual office, the doctor can achieve the dream of running a virtual clinic. We want the doctor home to be also a private office for the physician. So everybody can have their own private doctor, family doctor. And also it could also be a private doctors where a family can receive more holistic, personalized services. So this connotation is really about our private doctor to be, our in-house doctor to be fully upgraded. After the upgrade, they can develop a better access to the patients and communicate with patient on a better platform.
So the services that we have provided, you may see, it's leverage the resources of PingAn Group. And we leverage huge support and resources from PingAn Group in several aspects. First is the brand of PingAn Group. Indisputably, PingAn Group's brand is very well known, and it easily evolves users' immediate trust. The second is PingAn Group enjoys a huge client base. It has over 210 million financial customers, which is a huge source for our traffic. And also, the third support is huge channel resources. PingAn Group has over 400,000 corporate clients. A fourth aspect of support that the PingAn Group provides is the support of advanced health technology, which include smart AI-assisted diagnosis and treatment, and smart disease prediction, and some supervision, management, and services, etc. These are closely related to the technology that we are using. So I would like to make a brief summary here. The strategic upgrade that we have made since the mid of 2020 so that our investors and media friends can have a better understanding. The first upgrade is on channel. We have upgraded our channel from CN, individual and insurance end, to also incorporate our corporate clients and also hospital end. Second upgrade is on services. We upgrade our services in two fronts. First, we have upgraded from pure medical services to medical services and health management, healthcare services. You will see more products launching on the market going forward. We also upgraded our product portfolio from private doctors to private doctors and family doctors. So we expand our services from medical service for individual to medical services for household. The third upgrade is on capability. In the past, we focused on an in-house medical team, but now we expand our doctors network from in-house and also external doctor network. We will continue to expand the doctors network, particularly external doctors, general practitioners, and specialists, and in order to increase the professionalism of being a good doctor. We also migrated from online focus to online and offline combination. When we talk about online and offline combination, I don't mean we want to do heavy asset acquisition of hospital and etc. We just utilize our existing resources to provide support to dental care clinics, health checkup institutions, providers, to build connection with them and to form synergy with them, to empower them. And this is exactly what we are good at. This is also benefit from the huge offline support of PingAn Group. In the past, I have always been asked by investors and analysts about how is Good Doctor differentiate from other players? I think the biggest differentiator first is we are the largest internet healthcare entry portal with 346 million registered user, MAU of 67 million, and a daily queries of over 830,000. The number are increasing and is already much higher. And we also have a huge AI-assisted diagnosis and treatment system. It provides a good support for our in-house medical team. The training takes a long time to form that expertise. And we also have the huge support and resources from PingAn Group. PingAn Group, this is leveraged on the many years of experience and data accumulated. I would also like to share with you the highlights of our 2020 first half business performance. The several key numbers for you to take away. First is our revenue reached 2.75 billion, an increase of 25% year-on-year. Second is our revenue from online medical services rose by 107% year-on-year to reach 695 million. And our revenue, the revenue from membership products increased by 200% to reach 420 million RMB. Last but not least, just a recap of the key messages from my presentation. First, PingAn Good Doctor is China's largest internet healthcare entry portal. PingAn Good Doctor is a synergistic role entity and plays a synergistic role within PingAn Group's health ecosystem. And we will continue to deepen our role as the bridge between patients and doctor. Thank you.